Hey guys, welcome back to UWorld's Next Gen NCLEX review. My name is Ncoli. I'm a nurse here at UWorld here with another question drill set. Today's topic is everything post-operative. I know a couple weeks ago we did peri-operative, which is everything beginning, middle, and end after a surgery. But today we're going to focus on just things after a surgery procedure. So everything post-operatively. If you're new here, welcome along. We do these question drill sets every week, a couple times, Tuesdays and Thursdays mostly, but sometimes also on Tuesdays as well. If I said Wednesday, Thursday, whatever. We do it about 3 times a week, and we go over a whole bunch of questions and give you the answer choices, and so we can rationalize in the chat as well and be just a community and talk about some things. So let's get to it. Question 1. The nurse is caring for a client with a chest tube attached to a closed chest drainage system. Which of the following findings would be a priority to follow up? Option 1, intermittent bubbling observed in the water seal chamber. Option 2, crepitus around the insertion site. Option 3, serious drainage observed in the collection chamber. And option 4, clamped drainage tubing. Man, my words are off today. Let me know what you guys think in the chat, and we will go from there. I'll give y'all about 15 more seconds to figure it out, and we'll move on. If you're new here, I read the question off, give you about 30 seconds to drop your answers down in the chat, and also ask questions if you have any questions in the chat. We have Jackie here moderating for us. Then I'll go over the answer with a little bit of rationale about why the right answer is correct, and we'll move on from there. So the correct answer for this one is option 4, clamp drainage tubing. If you remember from a couple weeks ago, this was also on our previous question drill. So the main thing here is we need to know priority, what is the most important. A chest tube is a closed drainage system that is attached to the lung. It's goes through the skin into the lung to create negative pressure to kind of re-expand a collapsed lung or to drain any drainage from a lung. And it is helpful for these patients, and you have to be very particular with all the tubings. So if the drainage tubing is clamped, that defeats the whole purpose of the whole system. So we need to make sure that that is not clamped for whatever reason. So that would be our correct option for this question. Option 1, intermittent bubbling observed in the water seal. This is an expected finding. You can usually see this as patients cough or take very deep breaths. If it was continuous fluctuations, then it would be something to be more concerned about. Crepitus around the insertion site is usually also expected. If it starts spreading or going to the chest, then that would be more of concern. Option 3, serious drainage observed in the collection chamber. That is something that is expected, and we definitely want to drain and see in the collection chamber. So that is a good answer. Let's move on to question 2. The nurse is observing a staff member caring for a client with an arterial line in the right upper extremity. The nurse should intervene if the staff member is observed what? Option 1, inserting a peripheral venous access device in the left upper extremity. Option 2, zeroing the transducer at the level of the phlobostatic axis. Option 3, monitoring the insertion site for warmth and erythema. And option 4, administering analgesics through the arterial line. What should the nurse do and intervene? Let us know what you guys think in the chat today. And my favorite question to ask you guys, where are you guys tuning in from? I love to see how far UWorld reaches, and that's why I ask it every week, because it's so fun seeing how far we go. We get from Africa to Australia, Canada, not just in the United States. I like to see all around, but you can be specific too. I see West Palm Beach, Jamaica, Canada, South Africa, Nashville, Tennessee, Los Angeles, California, lots of places near and far, Iran, Kenya, Chicago, baby. Nice. Love, 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 love to see it. Correct answer for this one, administering analgesics through the arterial line. So what is an arterial line? Arterial line is an invasive device that we use to measure blood pressure invasively, and it's usually the most accurate reading. We also use it to draw labs for anything, but we never use it, or I can't say never, but we try not to use it for anything intravenously, like giving any fluids or giving any antibiotics. So that is the reason why option 4 is the correct answer, because we never want to administer anything through the line. We always like to take things out, take labs out, take blood samplings out, take a blood pressure, but never give anything through it. Option 1 is appropriate. We would like to administer or put a peripheral access site on the other arm to give any fluids. We try not to do anything on the same arm that the arterial line is or on the same extremity because we don't want to interfere if a blood pressure cuff or anything, we don't want anything to interfere with the arterial line. Zeroing the transducer at the level of the phlebostatic axis, that is correct. That is usually where we like to have everything level to get the most accurate reading. The phlebostatic axis is at the 4th intercostal space, right here in the mid-axillary line. So I kind of see it like a little bit underneath the armpit, and you want to make sure that it's there at all times, even when you reposition the patient. So if you sit them up or lay them down, you always want to zero out the transducer so it gives you a more accurate reading for the blood pressure. And then option 3, monitoring the insertion site for warmth and erythema. Of course, we want to monitor the site of anything intravenously to make sure it hasn't dislodged or there's no hemorrhaging. So correct answer is option 4. You guys did a great job. Next question. The nurse is caring for a client with a closed wound drainage system. Which of the following actions should the nurse take? Select all that apply. So select all that apply. So more than one right answer, guys. Let me know what you guys think. Also, be sure to check us out at uworldnursing.com. We have lots of lectures, topics ranging from adult health all the way to pediatric health. You can get the wide spectrum. You can do flashcards, create your own flashcards, question breaks. There's lots of great resources online for you to purchase as well. Not just the live sessions that we do and the lectures that we do, but there's great resources in our UWorld Nursing app as well. Good job, guys. Lots of good answers. Like I said, more than one right answer, so at least 2. Perfect. Correct answer for this one is options 2, 4, and 5. So select all that apply questions. I always think of them as true or false questions. So when you read it, is this a true statement or is this a false statement to whatever question it is asking? So which of the actions should the nurse take for a closed wound drainage? We want to document the color and consistency of the drainage. So that is correct. We want to secure the closed wound drainage to the client's gown. We don't want it flailing in the wind, and we don't want it to get caught on anything. So securing it to the gown will prevent all of that from happening. And then compressing the bulb prior to attaching it to the connection tube will help. If you compress it while it's attached to the connecting tubing, it can push air back into the space that it's trying to draw everything out, and it can cause complications. A closed wound drainage, I should have started with that in the beginning, is like a JP drain or a bulb drainage system. So it's a small little pocket that inflates with air, and as you compress it and it connects to the tubing into the patient's wound, it draws any air and drainage back into the bulb, and it will inflate with air. You want to assess the site frequently. So not daily, which is option 1. We want to assess it frequently to drain out any output that may happen, but also to make sure and monitor the actual insertion site that nothing infection or anything is happening. And then we never want to strip the connection tubing, which means like kind of pulling that drainage tubing to get every last drop in the drainage bulb. Sometimes doctors can order this, but this is under supervision, and we don't do this often, and it's usually not the best practice, so we try not to strip anything of the connection tubing, so that's why it's incorrect. So good job, guys. Options 3, 4, and 5. Next question. The nurse is teaching a client who has a new prescription for patient-controlled analgesia, a PCA. Which of the following information should the nurse include? Option 1, pain will be eliminated while receiving PCA. Option 2, continuous IV fluids will be connected to the PCA tubing. Option 3, medication is delivered each time the delivery button is passed. And option 4, family members can push the delivery button while you are sleeping. Let us know what you guys think. Lots of good answers, just flooding my chat. Great to see it. Did anyone join us on Tuesday for another question drill? I feel like this week we did a lot of question drill sets. What do y'all like question drill sets, or do y'all like lectures more? Let us know in the chat, and we'll try to incorporate one or more the other. This week we had a great variety of different random topics, and next week as well we have a lot of great topics. But do you like question drill sets, or do you like lectures more? Lots of questions. Okay. Correct answer for this one is option 2. Continuous IV fluids will be connected to the PCA tubing. So we want to look for the answer that should be included in the plan of care. So all of these other statements are false. With a PCA pump is a patient-controlled analgesia, which is what it stands for. So the patient control how much pain medicine, or not how much, but they can control when they can give themselves pain medication, and it's usually set up with a lockout time and a certain dosage that is verified with another nurse. So for instance, it could be morphine every 0.3 milligrams every 10 minutes, and then within that 10-minute time, they're not able to push it again. So every 10 minutes, they can get the 0.3, but within that time frame, it is not allowed. So it gives the patient more autonomy to control their pain, and it helps them be on better management of their pain, so they don't have to ask the nurse for pain medicines as often. It is connected to an IV fluid tubing because this helps push the medication in. That 0.3 is just a small little dose. So if it just goes 0.3 and nothing is there to kind of push it further into the patient, it's just going to stay at the tip of the IV line. So we have continuous fluids also going into the client. We usually Y-side it to the client with the PCA line going to the client, and then continuous fluids Y-sided in there. Option 1, pain will be eliminated while receiving PCA. It's not a guarantee that pain will be eliminated, but that is the goal, that it will definitely reduce the pain that the client is experiencing. So we can't say it will for sure eliminate everything. Medication is delivered each time the button is pressed. This could be correct if it is time for them to push it. Like I said, there is a lockout period. So if it is within the 10-minute period, or for however long the lockout period is, and they try to push the button, it's not going to give them the medication for safety concerns. We don't want them overdosing on this medication. So it is only delivered within the allotted lockout time. And then family members can push the delivery button. This is not true, and we highly encourage not to happen. The patient is the only one that is allowed to touch the button. We, as nurses, even hand the button back to the client, and like, if you're in pain, you can push it, it will light up, and it's all the patient's control. So that is the incorrect answer. Good job. Question 5. The nurse is teaching a client who had surgery 12 hours ago how to use an incentive spirometer. Which of the following information should the nurse include? Option 1, raise the head of the bed to 45 degrees before using the device. Option 2, use the incentive spirometer once per day for 1 week. Option 3, clench the teeth on the mouthpiece of the incentive spirometer. And option 4, inhale slowly to raise the piston to the goal marker. Let us know what you guys think in the chat. I know this semester is about to end for a lot of you guys, so which tool on our app in UWorld are y'all using the most, or is the most helpful to y'all? I know when I used it back in the day, well, we're not going to talk about that, but back in the day, I used the question bank the most. I challenged myself every hour, 10 questions. That was when I was in the deep of studying, 10 questions every hour, and I would just use questions all over again. But how do y'all guys use UWorld? Do y'all like the flashcards? I feel like that is another feature I probably would have used a lot. And quizzing myself on different diagnoses and different medications, that would be very good. But then also watching the lectures. That would be nice if you're like on a road trip somewhere, like for the holidays, just watching a whole bunch of different lectures that are on from varying different topics, including pharmacology. So let us know what you guys think. And we'll get to the correct answer, which is option 4. Inhale slowly to raise the piston to the goal marker. We're looking for statements, again, that are true and should be included in the care plan. So what an incentive spirometer does, it helps expand the lungs after being laying in bed rest or after procedure, to kind of help bring the lungs back to its normal elasticity, if you would say, but just taking bigger, deeper breaths to help prevent pneumonia and all of that stuff. So option 4 is the correct way to use the incentive spirometer. I always think of incentive spirometer, you inhale. You don't want to exhale and blow out. A lot of people think that you blow and try to push the piston up, but you actually inhale and increase your lung capacity when you use this. Option 1, you want them to sit up as much as you can while they're using this to help. Gravity works against us. So you want to push against gravity and have them sit up, and that would be the best choice for them. Option 2, use the incentive spirometer once per day for 1 week. That is not enough, and it won't be as effective. We like to encourage them to use it a lot more often. A lot of times in the hospital, we encourage them to use it like after every commercial break if they're watching TV. We try to have them do it 5 to 10 inhales at least 6 times a day. So if you watch a lot of TV, that could be a lot more for you. But we try to encourage repetition and many times with each repetition. So good job, guys. Oh, and then option 3, clench the teeth. We don't want to clench on the mouthpiece because that can inhibit our flow as we inhale. So you just want to seal your lips around the mouthpiece, not your teeth. Question 6, the nurse is caring for a client who had percutaneous coronary intervention via the right femoral artery 15 minutes ago. Which of the following actions should the nurse take? Select all that apply. Option 1, instruct the client to report changes in sensation to the right lower extremity. Option 2, inform the client that back pain is expected following the procedure. Option 3, monitor the client's right pedal pulse every 15 minutes. Option 4, initiate continuous cardiac monitoring for the client. And option 5, place the client in the high Fowler position. Let me know what you guys think. Good stuff. Also, let us know if you are recently passed your NCLEX or have scheduled your appointment to take your NCLEX. It's really nerve-wracking, but we would love to wish you the best of luck or congratulate you in either way. So yeah, let us know. what you guys think. Let's see. Miss Dree on TikTok just scheduled her NCLEX. Good luck to you. Wish you the best of luck. Someone just scheduled today. Miss Marina on TikTok as well just scheduled today. Next Tuesday, Miss Mindy on Instagram. Lots of good testing coming up. I wish you the best of luck. You got this. I know you can do well. You know the information. Just apply it. Breathe through it. You got it. Okay. Correct answer for this one is options 1, 3, and 4. So another select all to apply question. So think of them as true or false statements. So percutaneous coronary intervention, also known as a heart cath, which is when they go in through a vessel, usually femoral or radial, to go to the heart and try to open up any blocked artery and either place a stent or a balloon to re-help the perfusion with the blood flow. So option 1, instruct the client to report any changes to the sensation to the right lower extremity. Since this intervention, heart cath, they went in the right femoral artery, we definitely want to make sure anything in the right lower extremity is still full sensation. So monitoring for numbness, tingling, you're monitoring the color to make sure nothing is becoming necrotic or turning blue. So option 1 is definitely true. Monitor the client's pedal pulse every 15 minutes. Again, something that we want to assess because this can prevent us from having any complications and later on not having numbness and tingling. So this goes hand in hand with option 1. And then option 4, initiate continuous cardiac monitoring for the client. We are going into a large vessel and looking at the heart and blood flow to the heart. So we need to, or away from the heart. So we need to make sure that anything that we're interfering with the heart stays good. So we definitely put them on cardiac monitoring to prevent any complications. Options 2 and 5 are the incorrect answer. If a client is experiencing back pain after this, this is signs of retroperitoneal bleeding in the retroperitoneal space, and that is a big complication. So it is not an expected finding to be in pain in your backside. And then place the client in a high Fowler's position. We actually have them lay flat in the bed for a couple hours and on bed rest because we don't want to interfere and affect their bleeding risk. So they are on bleeding precautions and bed rest precautions to prevent any of that from happening. But you guys did very well on that one. Last question of the day. The nurse is caring for a client who had a modified radical mastectomy on the right breast 8 hours ago. Which of the following actions should the nurse take? Option 1, allow the client's closed wound drainage to hang freely. Option 2, place a safety alert bracelet on the client's left upper extremity. Option 3, obtain blood specimens from the client's left upper extremity. And option 4, encourage the client to sleep in the right lateral position. Let me know what you guys think. Good job. Also, let us know what topics are you guys interested in us covering. Again, as the semester is coming to a close, we can help guide y'all with some last minute drill sets or lectures to help y'all really get that information so y'all can ace y'all's finals and midterms. Good answer, guys. I see psychiatry, maternity, oncology, mental health. Yeah, fundamentals, oncology. I struggled with oncology a lot as well. It's a very niche specialty. Correct answer is option 3, obtain blood specimens from the client's left upper extremity. Okay, so a modified radical mastectomy. This is when they take your breast tissue and your lymph nodes from the area that is possibly infected, but they leave the muscle, and this can cause complications since they take those lymph nodes away. The lymph nodes help drain and have help with the circulation of lymph. So if you take that out, lymph can pool in your extremities. So we want to obtain blood specimens from anything or do any invasive procedures on the opposite arm. So we never want to poke or do blood pressures on a patient that has any lymph removal on that arm. So always go on the opposite side. So that is why option 3 is the correct answer, because we're going on the opposite side of the mastectomy on the right side. Option 1, allow the client's closed wound drainage system to hang freely. We don't want them to hang freely. We want to secure it to the gown to prevent any dislodgement or getting tugged or anything like that. Option 2, place a safety alert on the client's left upper extremity. We actually want to put it on the right upper extremity. The safety alert bracelet will go on the extremity that is actually affected, so it can alert anyone that is about to put a blood pressure cuff or about to stick them that you shouldn't use that arm. And then encourage the client to sleep in the right lateral position. We want to be on the left lateral position since that right side had all that surgery and stuff. We want to allow perfusion. So being up on their left side will be a better option for them. Good job, guys. Thank you guys for tuning in. Let us know how you guys did out of 7 questions today. And I hope you guys learned something new. As always, tune in every Tuesday, Wednesday, and Thursday for great topics, question drill sets, and lectures. And I will see you guys next week.